gets us to the first of the 3 Ps that can present problems for every woman that you just talked about.
The period, and that's how it gets started, with puberty. And basically the period a lot of women can have, besides those hormonal swings, which again, because the period starts up here, it can actually have cramps. And those cramps can happen because of 2 things. One is called prostaglandin. Those are the things that cause the pain that goes on in your uterus. The other is that what can happen is as the uterus cramps down because of those prostaglandins, it can crush the vessels, kind of expand on them, and cause pain by decreasing the oxygen that gets to them, just sort of like a decreasing oxygen if you had a problem with your coronary artery vessels. So it sort of, as it dilates and opens, it basically flattens those vessels out. Can you see that?
Women who exercise will get less cramping because exercise improves circulation and blood flow. And so maybe that's a good example of way to cut down on the
Because
cramps.
if you think about it, the uterus is a muscle. So it's just like, if you got a Charlie horse that wasn't getting enough oxygen to the vessels in that muscle. So it's the same thing that's going on with the uterus. So a lot of times what we'll do is calcium to help that out. There's other things you can do as well. A lot of women know about heating pads and warm baths, massages. There's all kinds of rose oil, ginger. All these things can be very helpful. But of course, to help with the prostaglandins that cause the pain, you can use over-the-counter non-steroidal anti-inflammatories, like ibuprofen, which is the best for cramps. Other things you can do is also to decrease that amount of bleeding is the pill.